Teresa Baker joins us today with important information regarding cervical cancer. So I guess that firstly we should talk about perhaps is what are the screening guidelines? What do we need to be looking out for?
So now we delay screening until 21. Your first pap smear should be at 21 years of age, and then every year or two through your 20s. That'll identify most of the patients that will be at risk. We can spread that screening out if they've all been normal between 30 and 50, and then we stop at 65 if everything's been normal for the last 20 years. So cervical cancer screening guidelines have changed quite a bit in the last 10 years, and they've kind of backed off those women that have had normal pap screens for a long time because we better understand that HPV is the reason that people develop cervical cancer.
And HPV happens earlier.
HPV happens when you're sexually active most of the time. So that's the whole push now, is to vaccinate against HPV. So HPV we vaccinate between 9 and 26. The earlier you vaccinate, the better. We liken it to like when you put on, when parents teach young girls to put on their helmet when they go for a bike ride. It's not when the car's coming at you. It's not after the car crash. It's when you're in the driveway. You can talk about risk. That's the time to vaccinate. So we vaccinate young, get them protected, and then later in their life, when they're making adult decisions, they're protected from HPV and the after effects of HPV.
Makes a lot of sense. Okay, so let's talk about a couple of the events that you have coming up to help people with this.
Yeah. In January, we have two big events. We just had one in Hereford, and that was a lot of fun. And then we have one in Pampa, January 19th, and we have one here at Hill the City on January 22nd. And if those two dates don't suit anybody, if they'll just call the number, we'll work around. We'll turn heaven and earth over to get them in for a pap smear screening.
So cervical cancer screening statistics, do you have data for this area in particular or just in general?
1 in 10,000 women die of, about 10,000 women will die of cervical cancer this year. We have a higher than the national average rate in the Texas Panhandle. The things that you have to think about, if it's been a long time since your last pap smear, and a long time means more than 3 to 5 years, if you're a tobacco user, if you have any kind of immunocompromise, like you're on long-term corticosteroids, or you have any kind of issue that would compromise your immune system, if you've ever had a bad pap smear, you need to come in and get a pap smear. Our best chance is if we get to you early and we can excise the lesion before it advances to cervical cancer.
So that's the whole thing, is early. It's sort of like in colon cancer and all these, in breast cancer, early detection is absolutely essential.
We could eradicate cervical cancer if we could vaccinate all the young women and if we could get to you before it advanced.
Okay, this is good advice. And we're going to put information on all of those events over on our website, myhighplains.com. Are there any things to look out for, though, if you feel like you might have some sort of a sign or symptom of cervical cancer?
The problem with cervical cancer is it's usually a very silent disease, and most women don't have symptoms. But if you have abnormal bleeding or abnormal discharge, come see your gynecologist and let us visit with you about pap smear screening.
Very good, Dr. Baker. You're always great to have a wealth of knowledge, for sure.
Thank you for
so
having
much.
us.
All right, coming up next, a new class focuses on forming habits to promote health and reduce your risk for chronic